The World Health Organization says vaccine hesitancy is among the top 10 threats to global health. Skeptics around the world have taken to the streets to protest against COVID-19 jabs. Half the French are hesitant about getting the shot. In Germany, it's a quarter of the population. But experts agree we'll only beat the virus with vaccines. Well, despite all the skepticism, the bigger problem has been getting enough doses. But not in Serbia. It has such a vast surplus that they had been inoculating non-residents. Still, the abundance of vaccine doesn't help when many people just don't want it. DW's Fanny Fachar reports.
It is the next person in line's turn. About 4,000 doses are being administered here today at the biggest COVID vaccination center in Serbia. The country has procured some 15 million vaccines for a population of 7 million.
Serbia has more vaccines on offer than Serbians who want them. In fact, there's a surplus of Russian, of Chinese and a variety of other vaccines. So the country had been inviting foreigners to take the jabs.
The emphasis is on had. On the 9th of April, the government decided to suspend the vaccination of foreigners until further notice. About 30,000 had received a vaccine so far.
A lot of foreigners came, but now it's impossible because of the permission of the government. So they need to be residents here or get married here or something like that for now.
The announcement came after Serbia's infection rates began rising again. The government had apparently realized it needed to convince more of its own citizens to get a jab first. At least 1 in 3 people in Serbia believes to some extent in conspiracy theories that claim vaccines are unsafe. You will see everyone who got the vaccine will soon die. I think the vaccine is not safe enough, and that's why I don't want to get it. And that skepticism is also apparent on Belgrade's streets. Restaurants are full, open, and almost no one is wearing a mask. Epidemiologist Zoran Radovanovic says the government focused too much on positive news about procuring vaccines, while not doing enough to actually stem the spread of the virus.
We have a populist government, and our leader was fond of demonstrating that he is more able than anyone else, any other leader, to provide what is needed. And he ignored the fact that it was necessary to educate people.
So far, about 1.2 million people have been fully vaccinated in Serbia, according to official numbers. A high percentage by comparison with other countries in Europe, but far from enough to end Serbia's pandemic. In an effort to increase immunization among Serbians, the government has now started focusing on its own citizens instead of foreigners. If you could understand Serbian, you would be able to read the message on the side of this local bus. It says, "Get vaccinated."
Let's talk about vaccine skepticism with Renee Najera, College of Physicians of Philadelphia. The fact we have a vaccine is a blessing. Why then all the non-believers?
Why the non-believers? That's a really good question, right? I guess it's part of human nature to question things around us, to see risk in other people and assume that it's the same risk for us. And so, you know, you're going to have a spectrum of people who absolutely believe in the science, absolutely believe in vaccines, and then you're going to have the other end, people who will not get a vaccine no matter what you tell them or how you explain it to them, because they have this perceived risk of it, no matter what they see.
I mean, it's great to question things. I'm a journalist. I have to do it every day. But vaccine skepticism is as old as the vaccine itself. Has there been, or was there, some sort of specific historical incident that would justify the skepticism?
Not one specific. There's been several ones throughout history, right? Because you know, the vaccine science has been advancing for the last 200 years, and along the way there have been incidents that may or may not justify some of their feelings. The most recent one was unexplained phenomena with the H1N1 vaccine in which people had narcolepsy. And we know that that happens to people who are predisposed to narcolepsy, who are exposed to a viral disease. And so whether or not they would have gotten it from the vaccine or from actually getting flu, that could happen. In the 1950s, there was the Cutter incident here in the U.S. with the polio vaccine, where a laboratory failed to properly kill the polio virus and ended up causing about 200 cases of paralysis from polio on what should have been an otherwise safe vaccine. So yes, along the way, there's been incidents that have been amplified, if you will, by the anti-vaccine movement as something that happens very, very often when in fact it's actually very rare.
Explain to our viewers how anti-Semitic conspiracy theories also play a role in the anti-vax movement.
Yeah, so, it's not just anti-Semitic, but anti-minority, anybody who is marginalized or excluded. And so, throughout history, Jewish people have been persecuted. They have been the minority, an ethnic minority, a religious minority. And so when it comes time to find somebody who's guilty for whatever ails a society, in this case with adverse vaccine reactions, then they turn to those conspiracy theories. In more modern times, we have conspiracy theories about Jewish people controlling bio security or controlling pharmaceutical companies and then wanting to just make money, right? That's one of the tropes of anti-Semitism and not caring, if you will, about children getting hurt from the vaccine. So it's a combination of historical factors of persecution of these kinds of groups combined with conspiracy theories and now in modern day social media where a small lie can spread and become very, very big.
Can you also explain why in some countries it's the ethnic minorities that are especially skeptical about vaccines?
Yeah, because, you have the colonizers, right? The Western European powers, England, Spain in the case of Latin America, England in the case of North America, who have colonized ethnic minority groups in foreign countries. And in doing so have used and abused. In the United States, we have the original sin of slavery. And so you have a history of hundreds and hundreds of years of the authorities, the government, the dominant political force or dominant people abusing the ethnic minorities. And so they see anything that comes their way as a mandate, as something that they must do for whatever reason. They see it as yet another imposition on them by this colonial power or this abusive, enslaving power. And so they get skeptical. And in many cases, there are some small instances that justify it. So, for example, in the United States, Puerto Rico, they have an island there, Vieques, beautiful island that was bombarded by the U.S. Navy for years. And a lot of the people from Puerto Rico are skeptical of the U.S. government because of that and other abuses that took place on their own island. And so now when they are being told by the same government that did that to them to get a vaccine, they're highly skeptical.
So, Renee, give me the hard sell. As a scientist, how would you convince an anti-vaxxer?
We've found through science, through research, through surveys, and through focus groups that the best way to get at somebody is by having one of their peers, not somebody who's superior to them, not somebody who's inferior, not somebody who's smarter, more educated, richer, whatever. Somebody who is their peer at their level. Explain to them the benefits of vaccination, explain to them the side effects, if any, of getting a vaccine. And we've seen it with the COVID-19 vaccine, where we had a lot of skeptical people at first who are now turning around and wanting the vaccine after seeing their peers, their neighbors, their friends getting the vaccine, having a little bit of a side effect afterward, a little bit of a flu-like illness for a day or so and getting much better. And then also seeing that the people who are vaccinated are not becoming sick and they're not becoming parts of outbreaks. When they see that from their peers especially, they have changed their minds. And so that is one of the science and evidence-proven ways to get at somebody who is skeptical about vaccination.
I don't mind at all if they wait. It means I get in line quicker. Renee Najira, College of Physicians of Philadelphia. Thanks for being on the show today.
Thank you for having me.
And for the last time this week, here's our science correspondent Derek Williams with another viewer question about vaccines. I was vaccinated a few days ago. My arm didn't hurt and I didn't have any side effects. Is that normal?
I've talked a lot here about vaccine side effects, so it's great to hear from someone who had none, because that's actually really common. I haven't been vaccinated yet, but among friends and family who have, I'd say roughly half told me they didn't notice a thing afterwards. Although the statistics will vary from vaccine to vaccine, it looks like for most of them, at least a third of all recipients don't report even the mildest of side effects, like injection site pain or a little bit of swelling. There's no way to predict in advance exactly how you'll react, but experts say two factors clearly increase the likelihood that you'll feel some kind of discomfort after getting a shot. The first is your sex. Recent CDC data shows that around 4 out of 5 reports of COVID vaccine side effects have come from women, which doesn't come as a surprise, really, since that's also been observed in the past with many other types of vaccine. A number of biological and possibly even social reasons seem to contribute to that phenomenon. The second factor that plays a role is your age. Younger people are a lot more likely to report side effects than those over 55, which is another result backed up by experience with past vaccines. The theory there is that's because the immune response in general declines with age. So, in a nutshell, having few or no side effects after being vaccinated isn't particularly rare, and apparently even less so if you're like me, a man who's no longer a spring chicken.
Neither am I, and I could get mine next week. Thanks for watching. Stay safe.